I started coughing up blood, and I didn't know what was happening at first. I didn't know it was TB.
We can't be sure if patients have TB without examining them, and even if we confirm it, we have no medicine to give them.
Myanmar has been battling with tuberculosis, or TB, since the 60s. But between 2015 and 2020, TB incidence was reduced by a fifth. However, with COVID-19, the military coup, conflict, and economic collapse, many TB cases are now going undetected and untreated. Hello and welcome to Do Athan, a weekly podcast about human rights stories from Myanmar. It's brought to you by Fondation Hirondelle. This episode is produced by Delta News Agency. Names and voices may have been changed to protect contributors.
I started coughing up blood, and I didn't know what was happening at first. I didn't know it was TB. Only after coughing up blood did I go to the clinic and find out what it was. They told me to do an ultrasound, but I couldn't afford it. It got worse, so I decided to get an ultrasound at a free clinic, and they told me that half of my lungs were already deteriorating.
Ma Thuzar was only 20 when she discovered she had TB last year. She's from Karen State, but she was a domestic worker in Yangon at the time. She suspects that she got TB from her employer, who had similar symptoms. When she got the diagnosis, she said she just wanted to die. Then she was fired. She had to rent a room in Yangon and was not exactly welcomed by the neighbours.
When I first got TB, people avoided me because they didn't want to get infected. I rented a small room in Yangon. When the lady from downstairs came to visit me with the kids, I told her not to visit. I told her that the kids were vulnerable to the disease. Sometimes the neighbors gossiped about me. I didn't listen to that. They said, "Don't go near her. She has TB. If we get infected, we'll die."
The World Health Organization, or WHO, noted in their 2023 report that the TB incidence rate rose by 3.9% globally between 2020 and 2022. They put this down to health service disruptions caused by the COVID-19 pandemic. Myanmar was one of the three biggest contributors to this increase. In 2022, the number of new TB patients for every 100,000 people in Myanmar was 475. That's up by 23% from 2018 figures. And that was 2 years ago. Reports from healthcare providers in Myanmar and on the border suggest the rate has increased significantly since then. Before the coup, there were around 1,000 facilities for TB testing and treatment throughout Myanmar. That's according to the junta's Ministry of Health. However, most TB centres were located in local community clinics and city-based hospitals. Some of these have been badly affected by the departure of medical staff who joined the civil disobedience movement. And in conflict-affected areas, some of these centres are closed. For those still open, patients may be unable to get to them, and they may not have the resources to treat TB patients. Dr. Saw Naing is a healthcare provider working in Chin State. She said they don't have the medical equipment to conduct tests on suspected TB patients. And with key transport routes cut off by the military regime, it's hard to get medicines.
Our Chin State is close to India, but buying medicines isn't easy. And India blocks us when we try to bring in medical equipment. We can't be sure if patients have TB without examining them, and even if we confirm it, we have no medicine to give them. It's really difficult to treat patients in an area like ours.
Healthcare workers in parts of Sagaing and Magway reported similar difficulties. All of this means that many TB cases are going undetected, unreported, and untreated. MAP Foundation in Thailand is seeing an increase in TB cases among migrants fleeing from Myanmar, particularly in the last 6 months. Hak Mung is the TB program lead at MAP.
Recently, many people have been leaving the country due to internal political matters. Many people migrated from the ethnic regions due to the conflicts. They don't normally get tested for TB. Some of them haven't had a chest X-ray test in the last year.
Hak Mung says most cases of TB are found in shared housing or in households with many family members. MAP helps share information about TB risks among migrants and also helps screen and treat people with TB. In 2022, in Chiang Mai province, around 10% of the suspected TB cases that MAP tested from screening were found to have TB. The next year, that percentage increased to 11.5%, but in just the first 5 months of 2024, around 80% of the tested from screening cases were found to have TB. The Shoklo Malaria Research Unit, or SMRU, in Ma Thuzar also provides free healthcare for refugees and migrants. The main centre and 6 other clinics along the border focus on malaria, TB and HIV, as well as general healthcare. Dr. Win Papatun, the TB programme lead, says they provide residential care for TB patients.
Migrant workers here get fired when they get sick and can't work. Even if they test positive and want treatment, they have nowhere to stay. No job, no money left. What's special about our clinic is that we provide shelter for the patient so they can stay put and not miss their pills. Normally, you need to take TB medicines for 6 months. This is what makes the SMRU TB clinic special.
Saw Naing was recently recuperating at the SMRU. The 42-year-old migrant is less than 5 feet tall and so thin that his bones protrude. He's worked as a farm labourer in the Ma Thuzar area for years. He recently got pulmonary TB for the 3rd time.
I started coughing again just like the first time. My joints were aching and it was painful to move around. So I went back to the student clinic and did a sputum test. Turns out, I tested positive for TB again.
The residential care given by SMRU ensures that TB patients complete their course of treatment and recover. That in turn helps contain the spread of drug-resistant TB, which doesn't respond to the usual drugs and takes longer and costs more to treat. The main cause of drug resistance is people not taking the full course of treatment, usually for at least 6 months. In 2022, Myanmar already had the 7th highest number of drug-resistant TB cases in the world, according to WHO. And an experienced doctor working on TB eradication in Yangon told Doathan she's very concerned that drug resistance is increasing. She's noticed herself that a growing number of patients have stopped coming to pick up their pills. Hak Mung from MAP says they've set up a system called Directly Observed Treatment, or DOT, to help ensure that their TB patients take their medication as prescribed.
We give treatment within the time frame to completely cure it, starting at a minimum of 6 months. We conduct workshops for volunteers on how to look after the patients and ensure the patients take medication regularly under the DOT strategy. We encourage patients to report on any development while taking medication, and we relay this information to doctors when we meet them.
Ma Thuzar struggled with her medication to begin with. She travelled all the way from Yangon to Ma Thuzar and got medicine at the Ma Thao clinic. But she was also trying to earn a living, working in road construction. She didn't always take her medicine regularly because she was tired and forgot, or because it caused side effects.
After taking medicine, I became dizzy. I had to work in the sun. The sun burned and I couldn't bear it. And the asphalt was boiling. I couldn't bear the heat. I often got fevers and coughs. I often coughed up blood. But at home, my food was not nutritious. It was just rice and pounded chili with salt. I didn't have any energy.
Fortunately, Ma Thuzar was referred to the SMRU in Mae Sot. She lived there, got the full course of treatment, and has recovered. She's now planning to find a job in Thailand. Ma Thuzar and Saw Naing are just two among hundreds of people saved by the SMRU TB program over the 9 years it's been in operation. They can care for around 300 patients most years. But to make a long-term difference in Myanmar, Dr. Wimpapatun says more investment in healthcare and economic development is needed.
There are still so many needs. I wouldn't say there's been much progress compared to before. In the UK, as their economy developed, the percentage of TB decreased. This shows it's related to a country's GDP, people's education levels, and living conditions. You can't just treat the disease alone. To reduce it, we should raise public awareness about TB and improve people's socioeconomic conditions, including their living situations.
Thanks for listening to this edition of Do Othan. We'd welcome your feedback on social media, and please follow or subscribe to our pages. This project on human rights reporting is supported by Fondation Hirondelle with the help of our donors. You can listen to our podcasts via the Do Othan Facebook page. They can also be found on SoundCloud, YouTube, iTunes, Spotify and Telegram. You can also listen every Saturday night from 9 to 10 p.m. and Sunday morning from 6 to 7 a.m. on Voice of America Radio. Please tune in again next week.